All right, good evening. Thank you for joining us. I'm Faye D'Souza. We all woke up to an interesting photograph of the Prime Minister getting his first dose of the vaccination this morning at the All India Institute of Medical Sciences. He urged everyone who qualifies for the vaccine in this phase to go ahead and get it. That's the photograph that we woke up to. Of course, two things to appreciate in this photograph. First of all, the Prime Minister setting an example and getting the vaccination, encouraging other people to do so. Also, a lot of people noted that he waited his turn and didn't jump the line in the first phase and waited until he qualified as an ordinary citizen above the age of 60 in the second phase to get that vaccination. So lots of questions, because now in this phase, everyone above the age of 60 can get a vaccination, and those above the age of 45 who have comorbidities qualify as well. Basically, all of our parents can get vaccinated, and we have a bunch of questions about, safety, efficacy, how to get this done. There were some issues with the CoWIN 2.0 portal this morning and this afternoon, but it seems that it might get sorted out in a day or so, and mostly people have been asked to hang in there. We're going to try and answer the questions, and I have just the person to answer questions on this particular topic. Dr. Professor K Srinath Reddy is the president of the Public Health Foundation of India, formerly the head of the Department of Cardiology at the All India Institute of Medical Sciences. He's amazing because he had such an amazing practice, and he switched really to public health because he believed that this is where the real service needs to be done. I would recommend that all of you just Google him, because there's so much to read that in his profile that we'll wind up spending the better part of half an hour introducing him to you. But Doc, thank you so much for joining us. It's a pleasure to have a conversation with you always. I want to first ask you this. We now have this open for senior citizens, and so far we understand that almost everyone in phase 1 has gotten at least one dose of the vaccination. Are you pleased with the process that we're taking in India?
I think this is a very well thought out staging of the vaccination program, because firstly, you will have to really look at who are the people who have to discharge essential functions. Because whether they are old or young, if they get sidelined by illness, even if it is relatively mild, they still have to be isolated at least for 2 or 3 weeks overall. And that will actually hamper a number of essential functions being done. And particularly so if they're health workers who also have to take care of the people who are ill and perform a number of health functions related to the COVID-19 process itself, whether it is testing or contact tracing or treatment, then we are going to be in serious trouble. Then the next stage comes in for other essential workers. But thirdly, we have to definitely go in for people who are most vulnerable. Yes. Because the main function of the vaccine is to protect people from getting severe illness and possibly even very severe adverse outcomes like deaths. So we have to protect those who are at the highest risk. And therefore, this is a stepwise process which is logical.
Right, Doc, of the questions that I have gotten right now on Twitter, and we've gotten a lot of questions on Twitter, most of them are about safety. People whose parents are in their 80s or their 90s, Parkinson's, glaucoma, blood pressure, on blood thinners right now. Is it safe for them? Should they go ahead and get it?
I think first thing that we must really emphasize is that people who have a number of health conditions are much more at a risk of severe disease and bad outcomes if they don't get immunized. So it is better for all such people to get immunized, but definitely we'll have to pay attention to the problems that they already have and see that they're under good control. Is blood pressure under good control? Is diabetes under good control? That is helpful for us, because if they're not under good control, then it's possible that the body itself may not necessarily take the vaccines very well to full effect. Because if your body is fighting inflammation otherwise, then it is unlikely to spend a good deal of its available resources for the vaccine's immunity response. So get these things under control. and then get vaccinated. But don't think that vaccine itself is going to be very harmful because you have a disease condition. And if you avoid the vaccine and get infected, the outcomes are likely to be very serious. And that's something that you would like to avoid.
So when you say get some of these conditions under control, blood pressure, diabetes, is there anything else that people should keep an eye out for?
Well, if there is any infection, for example, even if somebody is having a bad common cold or cough and or worse still a chest infection, all those will have to be cleared before they actually get treated, or a urinary tract infection or any other infection. So anything that is likely to interfere with the immune process, because either the body is now getting additional demands from other infections rather than focusing on creating an immune response to the vaccine, then you're sort of not getting the best out of your vaccine. But also you're increasing the risk of some side effects. So you get all of those things under control and then but it doesn't mean that every diabetic person who is well controlled or a high blood pressure person who is well controlled should avoid getting the vaccine at all because they've been labeled hypertensive or diabetic.
So it makes sense to get these tests done right before, if not on the morning, right before you go in to get that vaccination?
Well, most people would have already seen a physician at some point in time. If they have not seen a physician for a long time, then they should get their tests done. Blood pressure and blood sugar are often monitored by people themselves for monitoring. So if they feel confident that they're under good control, they can go straight away.
Okay. What about blood thinners? Is that a concern?
Well, there was a lot of confusion created on blood thinners because the companies put in all kinds of warnings and they got into the newspapers as well. Frankly, there is no real need for us to be worried about blood thinners because there are two types of blood thinners. One are called antiplatelet drugs like aspirin and clopidogrel, which are frequently used for people who have had heart attacks or angina or who might have had strokes and or might have had threatened strokes. So those are the kind of people who are usually put on these medicines to prevent clotting. And these act on blood cells which form the clots. But then there is a second category also called anticoagulants. They act on proteins called coagulation factors which are circulating in the blood. And then they actually trigger the process by which the clot is formed ultimately. So these are two pathways. Those who are on antiplatelet drugs like aspirin or clopidogrel need not worry because generally there should be no problem with that. If their dose has been excessive, they would have already noticed that they were getting some sort of a skin blotches where they were getting purple patches on the skin, and the doctors who were treating them would have already adjusted the dose. But if they're well controlled on these medicines, there is absolutely no need for them to worry at all. On the other hand, the anticoagulation is usually monitored frequently by tests called prothrombin time or INR. And usually that is tested every few weeks. And the doctors would have been monitoring them. And if that particular test is within the desired range, again, there's nothing to worry. The doctor would tell you that's okay to go ahead. And generally a thin needle, a gauge 23 or a 25 needle, if it is used, it will avoid the problem of a blood clot forming in the muscle. Because the big worry that you have when you are on this anticoagulant is that will there be a little extra bleeding into the muscle where the injection needle has gone in, and will there be a blood clot with a swelling, what we call a hematoma in technical language. But that can be avoided by using a thin needle and also by applying extra pressure after the injection is done. So actually, to tell you the truth, we have had a number of people who have had rheumatic valvular heart disease and operated with mechanical heart valves being put in, and they require anticoagulation lifelong, and they also require injection long-acting penicillin every 3 weeks. And they get it, despite the fact that they are on anticoagulants. So there is really no reason to worry if you're on those kind of blood thinners, as long as your blood tests are showing the desired range of effect. Only if it is excessive, then you have to worry.
So would you recommend then, doctor, is it fair to say that one should carry all reports and all details of any pre-existing condition, inform the doctor that or inform the people at the center where you're getting vaccinated, but there isn't any real reason to worry about any danger from the vaccination per se?
No, absolutely not. Basically, I would say that people who are on blood thinners, they should tell that they're on the blood thinners, or if they're on any other medication, they should say that they're on that medication. For example, if they're taking anti-allergy drugs or any other chemotherapy drugs, they should tell. But people who are on certain types of medicines may wish to consult their regular treating physician, get the advice, and carry that physician's note to the vaccination center.
Thank you. There are some questions about people who are taking psychiatric medication. Will that interfere in any way?
No, it should not. Obviously, the fact is, if they're agitated, if they're extremely anxious, depressed, then the way in which they react to the vaccination process itself may sometimes be affected. But in terms of the body's physiology, it should not be affected really in terms of any adverse effect being produced because of the interaction between the medicines they are taking and the vaccine itself.
Now, there are some questions from people who are saying that their parents are perhaps too frail and aged to travel to the hospital. Do you think that in the future there will be a possibility where people would come home to give them the vaccination?
Frailty is a challenge. There is absolutely no doubt about it. And that is where we have seen also problems, for example, in Norway, when suddenly there was a big newspaper report that a large number of people above the age of 90 had problems and several of them died as well. That is essentially because of severe frailty, and even the minor side effects of vaccination program might have tilted the balance if they had fever and were dehydrated, or it could have been a coincidental death, as the Norwegians also said. But frailty is a challenge, there's no doubt about it. But there, I believe we should make our best attempt to take the person to the hospital for one reason. Even if it is not that you are getting into a crowded ward or a queue, pre-negotiate the arrangement in which the elderly person is taken into a relatively quiet part of the hospital where they can be injected. While there are two reasons why. Firstly, these vaccines come in vials of multi-dose samples. So to individualize one injection for one person at home is going to be difficult unless a whole mohalla is being covered. Second is, if there is a minor or a major side effect, hopefully it may not be a major side effect, but even a minor side effect, the best place to be is in a hospital, to be monitored and treated. So ideally, yes, get it done in a hospital, or choose a relatively small hospital where there's not much crowd, make a booking so that there's no waiting list, and take.
So other questions, and you did say minor or major side effects. What kind of side effects could we expect? What's the least or the worst of it?
Well, it depends partly on the age and partly on the strength of your own immune response. Quite often it happens that stronger the immune response, that means the body is really charged up, then you are more likely to get more side effects sometimes. And particularly in terms of having minor side effects, usually you will get a little bit of pain at the injection site. There can be a little swelling. That pain may last for a day or two, or even less than that. But the other thing is sometimes you may get more muscle pains, other muscles as well. And also you can get fever, which can, as I said, last for a day or two. But usually it's a mild affair and not very common as well. You may get a headache. So these are some of the things that people get usually, but rarely you can get other side effects like fall in blood pressure, which has been called anaphylactoid reaction. Some people with high blood pressure, partly because of the injection and the anxiety associated with it, their blood pressure can rise. So these are some of the side effects, but none of them are really life-threatening, and most of them are transitory, will disappear in a few hours or maximum in a day or two. But the best is to actually ensure that you're adequately hydrated. Drink enough fluids before you go. Make sure that you're not been taking alcohol or smoking. These are some of the precautions which will make your body's immunity come up strongly and get the best benefit out of the vaccine, rather than have your body get less than the desired benefit.
The other question, Doc, is that is it possible to get COVID or to contract the virus in between doses? Because we know it's a 2-dose process right now.
Yes, you can, because it takes at least 14 days for a reasonably good immune reaction to come in. Because you're depending upon what are called the IgG antibodies, and you're also waiting for your cellular immunity or the T-cell immunity to get triggered and build up. They say that usually between 14 to 28 days, you get a reasonable immune response, but it's the booster dose that really charges your body up in terms of the immune response. So that's why you get your best result about 14 days after the second dose. But at least in the first 14 to 20 days after the first dose, you're still vulnerable, because your body has not yet built up that defense to the level that it can fight off the virus very well.
The question that a lot of people are asking is about the data. And the last time we spoke, there was a lack of. I'm sorry, my dog is barking.
No, I love dogs.
But is there now enough data to safely say that there is no risk to these vaccines and there is enough efficacy?
Well, basically, as far as risk is concerned, I think it's been studied adequately during the trial process as well as in the earlier stages. And we now know that in general, these are safe vaccines. We do definitely need to keep a watch out for side effects, even if they're minor, and record them. And then if there are significant side effects reported, then we need to investigate them fully. And that's why we do, even after they're fully available from the regulator's point of view, licensed, we do monitor what we call post-licensing or post-marketing surveillance, so that we continue in large numbers to monitor side effects which may not have been detected earlier. But the evidence so far is that these vaccines are safe. Other than these minor adverse effects, essentially they are safe.
There's also an understanding now that patients or candidates for the vaccine will not be given a choice between the 2 vaccine candidates available in the market. Now, a lot of people are also perhaps going to have a preference for one or the other. How do you expect, how would you recommend people tackle that challenge?
Well, basically, there is a choice still possible, because different hospitals are being supplied different types of vaccines. Some of the hospitals are getting Covaxin, some of them are getting Covishield. And it is known now which hospital is getting which vaccine. Generally, you can find out. So you have a choice of trying to find out which hospital is giving you the vaccine of your choice, and try and choose that as your preferred site when you register on the website. Then you will have a chance of getting the vaccine of your choice. Most of the private hospitals are getting Covishield. Some government hospitals are also getting Covishield, but Covaxin is substantially going to the government hospitals. So it is a matter of your choice of the center where you want to get vaccinated. So if you go to the CoWIN app and you have different centers in your neighborhood which are listed, then you can opt for the one where you feel you have a better chance of getting the vaccine of your choice.
Doctor, the CoWIN app or the system doesn't have details of which vaccine variant is available. So how does one find out? Do we call the hospital and ask them? Will they share that information?
Well, you could. I mean, they can certainly do that. There's no issue there. But as I said, right now, the government hospitals, most of them are getting Covaxin. The private hospitals, mostly they're getting Covishield. So you have some idea of what's going to happen there, but you can certainly call up and find out. It's intelligent guess.
A little bit and ask you if you have a preference between the two.
Well, at the moment, I am not yet listed. I'm going to register now because I am a retired faculty member from All India Institute of Medical Sciences, and I was not considered an active health worker right now of touching the patients at the moment. So I was waiting for my turn. I'll register now and then see which is the one which gives me an early opportunity to get vaccinated. So that's also a consideration.
Right. So one question coming in from one of our viewers right now, Dinakar Marela says, what about the remaining vaccinations that aren't available in India? Pfizer, Sputnik, we know that Johnson & Johnson has one now, Moderna has one. Will they ever be available in India, even in the private hospitals?
Well, Sputnik is going to be most likely available because Sputnik is now being manufactured in India under license. It is applied to the regulator for approval. They've asked for a little more information. Therefore, it's in the queue. It's likely that in a couple of weeks, it's going to be approved and then the stocks should be available in India. So we'll have 3. Then we may have Zydus Cadila as well. Then we may have biological E. So there are a number of vaccines that are actually being made in India, whether they were developed in India or whether they were actually licensed for manufacture in India. We are going to have a wider supply of vaccines in terms of variety. And over a period of the next few weeks to few months, we'll see them appearing. Now, as far as Pfizer and Moderna are concerned, they have to fulfill certain conditions. They first have to apply. They have to show whether they are asked to do a bridging study in some Indian patients or not. That has to be seen. Secondly, their cost has to be reasonable. Their refrigeration requirements, fortunately, have improved now. Previously, they were forbidding because you required for Pfizer minus 70 degrees centigrade. Now they've come down to minus 15 to 25, which is okay, because freezer temperature is minus 18 in the upper level of the fridge. But they have to make sure that they can supply in adequate quantities. Already, UK and Europe and others are fighting over the limited supplies. So will they be able to give us enough supplies and at what cost? So those are the questions that those companies will have to answer. But those who are already manufacturing in India, they're already likely to give us plenty of supplies over the next few months.
There was a column written in the Indian Express by Kumi Kapoor, which basically said that since the Serum Institute of India had stockpiled 200 million doses, and we haven't used a lot of it, is likelihood that a large portion of that stock, 25%, will expire at the end of April. And if it is not used, that would be a large amount of wastage, basically suggesting that India is not using the vaccines fast enough as to what has been manufactured. Do you agree that we've either been slow so far, or there is a likelihood that a large portion of our supply will expire?
Well, I think we were a little slow because we were prioritizing firstly the essential workers. And the number of private hospitals that were recruited were less, about 2,000 vaccination centers in private hospitals and about 10,000 in the public sector. Now, suddenly you're increasing the number of vaccination centers in the private sector to 20,000 from 2,000. And the public sector continues to operate anyway. So our ability to administer vaccines is suddenly going to rise quite fast. And we should be able to utilize a good deal of the stocks. Secondly, one of the reasons our vaccination was at a low ebb and not utilizing the stocks adequately was because of some vaccine hesitancy, as well as the feeling among a number of people that the pandemic has ended as far as India is concerned. We are safe. We've achieved the nirvana of herd immunity. We don't need to get vaccinated at all. So now those things are disappearing now, partly because we are seeing the cases rising. There is a sense of anxiety again. And secondly, now people are also seeing more of the general public getting vaccinated, including the political leaders. So the confidence is building up now. The demand is going to come up now.
Do you believe we might be entering a new wave? And we obviously, many experts have said we have not gone anywhere near the herd immunity required to protect ourselves. But is this wave likely to be as bad as what we've seen in the past, or is it going to pass quickly?
I don't think this wave should be as bad as what we have seen in the past, because we have learned several lessons, not always perfectly. But firstly, I think a number of susceptible people have been infected, but I don't think we have reached the herd immunity level at all. We do not even know what that level is. For example, in Brazil, in the province of Manaus, 76% of the people had antibody levels, but the pandemic continues. So we do not know what the level is actually for this. But secondly, we now also recognize that people are convinced that they must wear masks, they must keep a certain level of physical distancing. It's not perfect, but it's much better than at the beginning of the pandemic. So I don't think this is going to rise that fast, and vaccines also are going to be helpful for us now.
Doc, one question for you as a follow-up to our previous conversation, where you said quite clearly that you don't believe that offering the vaccine for a cost in private hospitals is a good idea. You said all vaccine inoculation programs in India have always been free, and this would actually lead to cornering of the resource to the private sector, where people are able to pay at the price now of 250 rupees per dose, 500 rupees then for both doses together. Do you still believe that this is a bad idea?
Well, getting the private sector to administer the vaccines is not a bad idea, but they have to do it under the conditions laid down by the public health policy, which means firstly, you say, okay, these are the categories of people who will get immunized turn by turn. It can't be just anybody who can pay. Essential workers, then the people who are at risk. So you have to follow those rules. Secondly, you can charge a little bit for your establishment charges. After all, you're running a hospital with nurses and staff, and who you have to pay. Therefore, a certain degree of markup is possible, but you can't have a very high markup and make profit out of it. So the whole idea here is not a profit-making exercise. The idea of releasing it into the open market for private purchase was that all the order would have been broken. Then anybody who can afford to pay more would get vaccinated, not the person who is vulnerable. So that's why getting the private sector to play alongside is not a problem, but they have to play by the rule book.
All right. Dr. Reddy, thank you so much for speaking with us and answering all of those questions. It is always a pleasure to have a conversation with you.
Thank you. Thanks a lot. Bye. And I must get to see your dog next time. You must show it on the camera.
She's taking a nap on the sofa, but we will feed it.
Okay.
I will bring her on camera next time. Thank you so much for spending time with us.
But your dog had some questions to ask of me. Maybe later.
It does.
Bye.
It does seem appreciated. We hope we answered most of our questions that our viewers asked.
Right.
And of course, if there are more questions, keep sending them to us, and we'll ask Dr. Reddy to come back and answer more questions again in the future. Stay safe, guys, till you get that vaccination. Make sure that you keep your mask on, you sanitize, you maintain social distancing. Even for those of our parents who do get vaccinated, remember, between the 2 doses, you still have to stay as safe as possible. Stay safe. Thanks for watching. Remember, our news will be up at 9 p.m. 10 minutes of a quick wrap of everything that happened that you should know about. Watch it at 9 p.m. For now. Thanks for watching.